Good morning, everyone. My name is Darren, and I'm a service manager from Care First. So I'm pleased to say today we're going to be doing the webinar on MSDs, and I've got Peter from Team Prevent who will be doing it today. I just want to run through some sort of housekeeping rules to start with. So if anyone has any questions, there is a questions pane. I believe it's on the right-hand side of your screen. If you write them in there, you can write them in as we're going. And what we will do is I will read all the questions out to Peter at the end, and then Peter will do his best to answer them for you. Also, if anyone does have any sound issues today, sometimes it can be your organisation's IT system, so it might just be worth logging out and then logging back in again, or trying a different device if you've got a different device to hand. But normally, unless we get lots of questions coming through saying that there are sound issues, normally it is a like I say, I guess an IT issue from your organisation, maybe a firewall blocking it. So thank you so much to Peter from Team Prevent, who's going to do today's webinar. And I'll introduce Peter now, and he'll take us through the slides.
All right, so hello everyone. My name is Peter. So I'll be going over musculoskeletal disorders in the workplace. I'm going to touch up on the different types of pain, and then we'll finish off by going over some DSE advice. So let's start. Right, so what is an MSD? Musculoskeletal disorders, or MSDs, are conditions that affect the nerves, tendons, muscles, and supporting structures, such as discs in your back. They result from one or more of these issues having to work harder than they're designed to. MSDs are extremely common, and your risk increases with age. So the prevalence around MSDs, so it affects 1 in 4 of the adult population, many being of young working age, and it's highly prevalent among multi-comorbidities. Musculoskeletal conditions are commonly linked with depression and increase the risk of developing with other chronic health conditions. Early management keeps people at work or enables them to return to work more quickly. And this will then potentially reduce further treatment down the line and will also optimize recovery. So we know that it is accounting for 30% of GP consultations, and we're seeing about 10.8 million working days lost as a consequence to musculoskeletal conditions. This has been accounting for about 25% of all surgical interventions on the NHS, which are set to rise significantly over the next 10 years. And we're seeing it accounts for £4.76 billion of NHS spending every year. So you can see it's very prevalent. Let's go now to acute and chronic pain. So pain is something that we all experience. Although it's not nice when we have pain, it's an important part of the body's safety mechanism to help us avoid further pain or injury. Acute pain is usually well known, meaning there's an obvious cause. It's short term for about up to 3-6 months, or when the cause is healed. The focus is going to be on things like treatment like physiotherapy. Chronic pain, however, is usually not associated with any disease or injury, and the scans, when you usually have them, are usually clear. It doesn't really serve a purpose for the body, and treatment is going to be usually around self-management techniques and advice. And this can also be given by a chartered physiotherapist. So chronic pain is often referred to pain that does not go away as expected after an injury or illness. So some common themes when you assess people, you usually find that someone with chronic pain just will constantly refer to the initial event that caused that pain, and it may be a few months ago, a few years ago. But we know that the nerves are described as oversensitive, and they will continue to send those warning messages even when there is no injury or the original injury has healed. So the management of pain, what you want to do with acute pain, this should be self-managed with medication, either shot bought or prescriptions from the GP. You also use things of price, so with like PE protection being protecting the area with the use of a splint or sling, say, for example. And however, with chronic pain, though, the affected person will need to look at their mental, emotional, and physical needs and see what they're able to improve in those areas. They also may need to seek help from the GP and maybe even be referred into a relevant service. Other management techniques will need to be things like look at good sleep, look at a well-balanced diet. But the biggest challenge you'll find is that you will need to have changes to their behavior. This will be getting them to react differently to when the pain is there. This can be achieved with things like CBT, relaxation, and meditation. Remember, chronic pain is deep-rooted, and therefore the attitude around the perception of pain needs to change. You will need to focus on the positive thoughts of what they can do, and that the activity, this is important, the activity causing them is not causing them any harm. So more importantly, you need to keep people active. You need them to do exercise, because all of this has been proven to help with muscle strength, decrease stiffness, and even pain. So maybe focusing on activities they enjoy, definitely speaking to the GP about pain relief and pain management, maybe even counselling. So that leads me on to back pain. So with back pain, 80% of the population is going to experience. It is normal to have back pain from time to time. Only about 1% of back pain is serious, and this is easily identified for our red flag system. Reoccurrence is high, about 40–50% within a year. And 80% of people with back pain are unable to be diagnosed, meaning the cause or diagnosed, it cannot be found, meaning it's not serious. And you usually find that this will be referred to as mechanical low back pain. Back pain should never result in a long-term disability if properly managed. So going on to Mythbusters, we have these, and these help with talking to people about back pain. So due to the high prevalence of back pain, campaigns have been launched for the public to help understanding. Professional bodies such as NICE, CSP, BMJ, they've also created easy access to information for the public to read. And physiotherapists will include Mythbusters and re-education programs around back pain. As you can see, there's one of the Mythbusters on the screen. So it's not uncommon to see these around in clinics and people talking about them. Here on this screen, we have MRI scans showing 2 patients with herniated lumbar discs. You also find that maybe people will talk about the disc being slip discs, prolapse discs. You'll find all these kind of damaging words that can be damaging to a person. Sometimes maybe it's best to speak, when you speak about lumbar discs, to talk about them in terms of inflammation. This way, with inflammation, you have the kind of discussion point, and that inflammation will, will eventually go down. So on the left, you've got a small herniation, and on the right, a larger herniation. Now, usually I get people to think about which one, in their opinion, where they think it require surgery. So in actual fact, neither. Both of these patients had minor symptoms, and they did well with physiotherapy and anti-inflammatory medications. It is very important that we treat the individual patient and not the MRI. Here we have NICE guidelines. So NICE guidelines have become a vital part of treatment of the patient with lower back pain. It ensures all healthcare professionals are up to date with the relevant evidence, and that will guide us. I tend to use it in treatment as well when I talk to patients about lower back pain. So for example, they may talk to me a long time about having a scan, how they need a scan, how they want to be referred to a scan. So I just talk to them to say that, look, actually a scan's not necessary. So it's a good guidance to show them that why we're saying stuff is actually, it's guided around that through evidence. So the importance of exercise. This can reduce your risk of major illnesses such as heart disease, stroke, and type 2 diabetes, and cancer for up to 50%, and lower your risk of death for up to 30%. Research shows that physical activity can also boost self-esteem, mood, sleep quality, and energy, as well as reducing your risk of stress, depression, dementia, and Alzheimer's disease. Exercise is free and can be participated in many forms, and it is the most cost-effective treatment available. So to stay healthy, adults should try to be active every day and aim to achieve at least 150 minutes of physical activity over a week for a variety of different exercises. You need to be moving quick enough to raise your heart rate breathe faster, and feel warmer. So this level of activity is called moderate intensity activity. If you're working at a moderate intensity activity, you should still be able to talk, but maybe not sing. So the next level of exercise intensity is called vigorous activity. And there is substantial evidence to say that this type of activity can bring health benefits over and above that of moderate activity. So let's go on to DSE and home working now. So the United Kingdom has seen 8.7 million workers work at some point from home in the last few months, and this number could remain high if businesses cannot ensure the correct social distancing measures. So that's about 30% of the workforce, and there's some predictions that have suggested that maybe this could even rise to 50%. Just for everyone's knowledge, so in order to qualify under DSE, the health and safety regulations of 1992 and the amended 2002, you should really be using your computer laptop for continuous or more continuous spells of an hour. So you may come across people that you're assessing that actually in their job description or their contractual duties, that they should be only using a laptop for 20 minutes and they should be maybe doing other things, maybe walking around, other activities that they've been asked to do. So just, maybe they may not come under the DSE regulations. However, I believe it's good practice if you're asking anyone to maybe doing some display screen equipment that potentially you should be going over DSE stuff. So the reason why going over with this slide, DSE and home working will bring computer-related health problems. So with aches and pains, DSE stuff can be caused by the repetitive nature of work of it, the uncomfortable working postures that you put in, the incorrect screen settings, and the carrying out tasks for long periods without a suitable rest break. So we've been doing some surveys, and we've been noticing that more recently, home workers are reporting to us that they have poor equipment at home, that there's a lack of space, that they have to share that space with others at home, and that they have a lack of quiet time and space. Naturally, and this is going to be from, we've asked a lot of workers to start working from home when they're probably used to the office environment. So they've gone home and they have the children around, they've got busy things happening, and so that they're not getting that quiet time and space that they should have got. So let's have a look at the next slide. So DSE, it's always good practice for the employer to undertake DSE self-management questionnaire at the workstation. So that means you identify a problem, or you're getting a little bit of aches and pains. So you go to your employer and they should give you that DSE self-assessment for your workstation. Once you've completed that yourself, that should then be reviewed by your health and safety. And then they will discuss any kind of issues with management. So your employer then would work to resolve those issues arising from that assessment. And any medical issues that is found should be referred to occupational health. The DSE assessment must be reviewed if any significant changes occur in the workplace or it's been 3 years since your last assessment. Line manager should remind you of when your next review is. So some things that the physios would go over on the DSE assessment and advice, they'll be looking at your chair, looking to make sure it's all set up correctly, so how it should be. We will look at making sure your feet rest on the floor, place your screen at eye level, have your keyboard straight in front of you, keep your mouse close, avoid screen reflection, make objects easy to reach, avoid phone strain, so using things like headsets, and taking regular breaks. So with the DSE, so just so you know a bit of facts about posture. So poor posture at your desk can reduce your ability to intake oxygen. So sitting up straight can increase your oxygen intake by as much as 30%, meaning increased airflow will equal more oxygen to the brain and muscles and therefore an overall energy boost and arguably better productivity. So at Team Prevent, we ensure that we go over all of this with our clients. We have things like full catalogues of self-help techniques, health and safety toolkits, pathway procedures on DSE for employers. We have pathways on working from home, exercise, advice sheets, mental well-being programs, and it's all just to name a few. So you're never not supported, and your employers should really be putting you in these right directions as well. What I've done as well, just as a kind of parting gift of this assessment, I've given you some advice and exercise sheets that you can go over yourselves as well. So any questions, I'll be happy to answer from this. So fire away.
Perfect. Thank you so much for that, Peter. That was really interesting as well for me, being fairly new to Care First. And for anyone that doesn't know, I've been with Care First for about 3 months now. Before that, I was in retail, so obviously the same as probably a lot of you guys, sit on a computer a lot more now. So it's really interesting to learn some more about MSDs. So I've got a few questions coming, Peter. The first one was when you were looking at the MRI scans.
Yeah.
Basically, it's just saying that psychologically, is the human structure a bad design then?
Well, that question is quite big. So actually, the human structure is a perfect design in the sense that how it depends on how you look at it. Be careful with the words here. With evolution stuff, it's adapted very, very well for us to be standing up straight. What we find as a medical person, what I find the biggest issues is that we're not optimizing the muscle system more effectively. The muscle system, best way I can do it in layman's terms, is it's a shock absorber system. And so you need to have that level of ability of strength within the different muscle groups in order to use the body at its most optimum. But with 21st century, I call it kind of the 21st century disease. We've got phones, we have computers, laptops. It kind of puts us into positions where evolution hasn't been able to catch up with. So that puts an additional strain on the body in certain areas. But we do know that to combat it, that's why exercise and movement is so important. So when you do your kind of DSE workstation kind of policy assessment that most all companies should really do, you should be getting up every 20 minutes, I say. It says it'll be about 20 to 40, but 20 minutes preferably to get up, stretch about, kind of reset those muscle groups again. And that should lower the risk of any kind of issues that people get. Does that help?
No, that's a great answer. There's a couple that I can answer a minute as well, Peter. A couple of people have asked, where do we get the access to the exercise links that we spoke about at the end of the presentation? So what I'm going to do after the webinar later on today, I will email everyone that's registered for this webinar with the attachment of the documents that Peter has shared with me. So I will get them all out to you later on today. And one of the other questions that I can answer is someone's asked, will this webinar be available to rewatch? It will be. It's being recorded as we speak. So all you do is use the exact same link that you used to access this today, and that will take you to the recording once obviously this webinar has been complete. So you can just use the same link and it will take you back into it. I've got a few more questions come through, Peter. I'll ask you them. I'm not sure if you're going to know necessarily answers to all of them, but this one is, I've ran several marathons, and as a mountaineer, do I need to brace myself for deterioration of the skeletal system, for example, back, joints, etc.?
The evidence is quite mixed on this one. It depends on my personal experience as well. Yes, there could be a link to what we call further wear and tear with people who maybe, say, work in the construction industry, maybe who participate in kind of vigorous kind of high level sport. And we've always kind of said, look, it maybe is to be expected. However, there is more and more recent evidence that's coming out that actually people who kind of are in kind of weight-bearing activity kind of jobs, people who are participating in sports such as running, jumping, etc., we're actually finding that cartilage is being thickened. So our theories around, potentially getting more wear and tear is being thrown out the window. So the kind of it's still out there. Lots of research needs to be done, but yes, on one hand, there could be potential to a bit of wear and tear, but on the actual other hand, we're finding that the people who do participate in stuff like high-level weight-bearing kind of exercise or activities are actually being better off, and you could be actually protecting those jobs for those later years. But either way, it doesn't really matter. When we all get to a certain age in older life, older adults as we become, it is quite natural, it's very natural for all of us to have wear and tear on our body. So it's a natural part of aging. So I wouldn't overthink it. I actually actively encourage all my patients who have got osteo kind of arthritis or the wear and tear, as we like to try to talk about it, or people who have undergone total kind of knee replacements, etc., to actually participate back in those sports, get them back into tennis, get them back into doing Ironman or whatever it is. Last year, I had one person who had 2 total knee replacements. I got him back on the slopes. So he was skiing and he never been happier. So yeah, push your body to whatever you can do comfortably, and try not to overthink what that could mean in the future. Okay.
That's great. Thank you, Peter. I've got another question here. I don't know again if you'll know, but I have ataxic cerebral palsy and often get shin splints because of my walking stride. Any advice on how to manage shin splints?
Yeah, so as you're probably going to be more aware, it's going to be biomechanical changes that's happening due to the kind of the muscles being contracted in different areas. I'm guessing that there would be a physiotherapy on the case here, but what they would be looking at is trying to optimize as best as possible. So lengthening those muscles in your case, so doing lots of stretches. You'll be having active stretches where you're doing it yourself, and more passively where the physio probably may be getting involved as well. But yes, you want to be looking. Well, you're going to have rates, especially if you're participating more vigorous activity. You will need to have all your kind of splints, shoes, and that reviewed regularly, because you're going to have a bit more wear and tear in certain areas, and plus you've got the actual thing of skin protection as well with you. So in this, it's optimizing stretching and re-looking at all your use of the aids that you're giving as well, more regularly on a regular basis. That's the best way with it. Okay.
Perfect. And another one. Sorry, we've got lots of questions, Peter, which is great. So, any advice for osteoporosis of the spine?
Osteoporosis.
There's a little bit more information. Sorry, Peter. It's basically saying that this person was diagnosed and given I'm not gonna. I can't pronounce this word that well, but it's alendronic acid with vitamin C and D twice a day, and do weight-bearing exercise. This person says, I enjoy walking, but I'm concerned about uphill and putting too much strain on my spine.
So with osteoporosis, it's going to have that level of medical management. So that means the GP will be involved, potentially even the specialist. You may have a 12-month review, or maybe not. Or GP might just keep it in-house. But yeah, definitely you'll be on all that medication. Definitely lots of vitamin Ds. Being exposed to low-level bits of the sun, potentially can help. Weight-bearing activities is key in this one. So yes, you'll start with all your gentle kind of non-impact. So you kind of walking, cycling, that could be on a static bike, swimming, trying to get your muscle system very strong. Now with the walking uphill and stuff, I actually tend to encourage my patients to do exercises that puts them, it makes them act a little bit more kind of vigorous than their normal activities, but being very careful that it doesn't cause obvious kind of fractures. So yes, you've got to be careful with what you're doing. You're not going to probably go into your jumping sports and jumping off things, because you put that extra force through the joints and the bones. But you don't want to be ever put yourself off walking things like up hills, putting off anything that would have an impact on your daily activities and your quality of life. So yeah, to answer, I wouldn't be too afraid. I would be doing it. I would be doing the walking. Your body will tell you what you're really struggling with. And unfortunately, sometimes with osteoarthritis, depending on the level, sometimes people do tend to just get a slight stress fracture, but that's part of the condition. But it's about highlighting it and trying to avoid if there was an obvious cause from it. Okay?
That's fine. And I've got another question. Oh, sorry, Peter.
Yeah.
So the next one is, my understanding was that the DSE regs did apply to home workers if the percentage of time was spent working at home. Please, can you clarify?
So it's been released from the Occupational Health Society that we follow, our professional body. In theory, it doesn't really apply to the kind of short term. So if your employer sent you home at kind of a short term, really short term basis, and they were going to get you back into the office, in theory, it wouldn't really apply. The same with if they've given you other activities to do whilst you're at home, so you're not continuously having spells. But remember, that's for the employer to decide. From an occupational health point of view, as a medical point of view, as a healthcare professional, I would actively encourage everyone to have the DSE and to just do it because, why not? It's easy access to the self-assessments now. It's easy access for most companies now to have an occupational health provider. So it's not an actual difficult thing to offer it to all employees. But yeah, looking at the actual regulation and what's coming out of the professional bodies, depending on how short term that person was meant to be working from, it may not have applied. But yes, okay, does that answer it?
Yeah, that's perfect. The next one is, most of our staff are using laptops all day at home. What can they do to protect their health?
Okay, so laptops, massive debate in it. Lots of people, they like it 'cause it's mobile, it's on the go. But remember, that's what it is. A laptop was designed for mobile on the go. It is meant to be designed for short-term use. But we're finding more and more people. Sometimes I'm guilty of it as well. If I've got a busy day and I'm still on the laptop. You will tend to just work because it's easier. Now, you've got to, this is why, again, I encourage DSE, because DSE is educational purposes as well. People will be educated on what the use of a laptop was and is for about. Your employee, if you're going to be doing longer periods, your employer should be really offering maybe screens, maybe 2 additional screens, or a laptop and a screen, because you've got, with the laptop, the screens are not always going to be the better kind of quality for your eyesight. It can actually cause the muscles to get overtired, and therefore you get blurred vision, temporary blurred vision, stuff like this. So you should be working off a screen. Also, it's the height at which laptops work at. It's not always, you can't really screen adjust it unless you've got a laptop kind of razor. It's not the best for your posture. You probably, guys are working off it now on this presentation, you're probably a bit hunched over at the moment, maybe trying to listen into the speaker, etc. So yes, you should really, maybe if you're finding you do come under the DSE regulation, maybe you should be going back to your employer and saying, look, what else is there to offer? I want to maybe protect my my posture, or maybe the screens to glare for my eyes. So yeah, these are the discussions I was talking about with the with your employer about the DSE. Does that help answer that bit?
Yeah, that's perfect, Peter. And sorry, there's lots of questions. So the next one is, what type of lower back pain would flag up concern?
So when you have lower back pain, it's not nice. It's a horrible thing to have. but it's about educating, maybe educate yourself, maybe going to a healthcare professional who knows, who can educate as well about what back pain is. Back pain is a very, very common condition. 90% of all back pain will just heal on its own, just like that. So what we do when you see a healthcare professional, we go over things like red flags. And these red flags are special questions that will help the healthcare professional just highlight whether if there is cause for concern and that we need maybe to maybe discuss with the GP or maybe even a specialist. But once, and all healthcare professionals do it, so anyone with back pain, it is a healthcare professional must go over these questions. So you're all going to have it at some point if you were to go to the healthcare professional. Now, if the healthcare professional screened it and they're managing you via their own kind of advice and exercises, rest assured it probably is, it's that non-specific low back pain, that mechanical low back pain that you may hear. So it just means that you maybe got some tightness in an area, or maybe that your body's maybe ill-aligned a bit, maybe tightness in in your legs, in your shoulders, your neck. And once you've kind of reviewed and refresh those areas, the lower back pain then should resolve on its own. So yeah, don't rest assured if you've got lower back pain. If you think it's significant to you, then see a healthcare professional. They will review you, they will screen you, and they will manage you how it should be. Okay.
Perfect. Thank you. So the next one is any advice for people who need support with carpal tunnel syndrome?
Yeah, so carpal tunnel is again, it's a very nasty thing to have, and this is quite common. If you look at the prevalence of DSE work, people using displacement equipment, carpal tunnel is up there. It is very, very common with them, and that's usually because if the setup is wrong, or you're overreaching stuff, or you're grabbing phones all the time, typing. You're one of these fast typers that have to type all the time. You're gonna develop it. Now, carpal tunnel, the term I feel gets used around a bit too much, especially by doctors. When we look into it, there's a lot of kind of what we call nerve irritation rather than the actual diagnosis of carpal tunnel. And nerve irritation can come from different points in the body, either neck, shoulder, elbow, wrist. And what that means is that something in maybe your work setup or what you're doing is incorrect, and therefore it's just causing irritation of the nerve. And what happens if you go through the DSE, maybe have some physio, these things get resolved very, very quickly. If it is actual carpal tunnel and it's progressed and there's actual structures around that's causing that issue, that's when the doctor will then refer you to the specialist, because yes, physiotherapy can help at some point, but you may need a surgical review where the consultant will look at it and say, right, okay, yes, physios help with up to a certain point, but there may be a structure that the doctor needs to intervene with. And that's what real carpal tunnel you'll find you have. But again, prevalence of people having the carpal tunnel surgery is quite good. Things do tend to resolve. But first things first, you always look at your work setup because it's probably something that's wrong that's being done. Okay.
Perfect. And so another one that's just come through is, if you already have a back injury, do you need to do anything extra to support yourself? For example, this person is working from home at the minute, so they get up frequently and stretch sort of every 20 minutes. But what they're basically saying is if they sit up straight, it hurts them more than when they actually slouch.
Okay. Yeah, this is quite common as well. So your body's getting used to the different positions. So it's finding that the slouching, the things that we don't advise, is becoming what's more comfortable. It's just about retraining the body. Sometimes upping one's exercise, maybe doing a lifestyle change, as in say joining the gym, but that does during COVID-19 it's not going to happen. But doing a different part of exercise, you may find that gets you out of that habit. It strengthens a different part of the muscles, the core muscles you may hear thrown about quite often. It may strengthen a bit, that gets you out of that habit. Now, I always advise my guys with previous historic kind of back pain, just look into it. You know your back better than anyone. Yes, be getting up more regularly. Be making sure that you're in comfortable postures that don't that will not aggravate it for later on down the line. Really look at all your equipment, the chair, everything to do with the DSE should be re-looked at. But with this, it's all my backs, especially guys with historic backs, you should be maintaining it in a way that exercise is your key go-to. Exercise, I can't stress, is so important for anybody with acute or the kind of more chronic kind of issues with back they've had historically. It's the only kind of best evidence-based thing we have that proves that will reduce your symptoms. Okay.
Perfect. And the next one, sorry, Peter, there's loads. Any advice to avoid or improve tennis elbow?
Tennis elbow, I truly believe that it is a physiotherapy management of it, because tennis elbow, you might have referred pain from different areas. So again, it's very difficult without assessing it. That's why physiotherapy should be the first go-to. Usually with tennis elbow, although you might find that the word doesn't get used as often anymore. But what you should be looking at is, you may find we should be really using the word lateral epicondylitis, not the term tennis elbow, because we're just going away from that now. But it's usually, what my experience I find is weakness of the muscles, usually the forearm muscles. So over repetitive action, maybe that's causing it. You had a secondary issue with weakness, that's then causing that pain. But tennis elbow, if you're lucky, it can resolve on its own. Some people get used to splints, they do self-massage, they may be taking anti-inflammatories, which help it resolve. But if you find it's hovering, it's still hanging around, then you must see a physio, because it is the best person that can manage it and help effectively make it go away. Okay.
Perfect. The last one for Peter, because there's so many of them, and I'm conscious of time. So, what exercises do you recommend for wrist and shoulder pain from repetitive strain injury?
So I always start off with basics with everybody I come across with these. So I always say, look, posture. It is key. And I find that that's where it's coming from. It go back to that 21st century disease that we're all developing. It is from that. So I get people to, first of all, you must do things like deep breathing exercises. We all take advantage of. The deep breathing exercise is simple. All you do is, I tend to find a nice place, preferably outside in the green. It will help your mental health as well. But you be outside, take a deep breath in through your nose, breathe in as much as you can, hold for about 2-3 seconds. So it's all in your lung, make the gas exchange happen, and then breathe out through your mouth, pursed lip breathing, and do that about 2 or 3 times. Now, what that does, that expands your lungs, and therefore just ever so slightly changing the mechanics of your chest, so your ribs are kind of, your whole body's more upright. Now, from there, you then can get your shoulders and just place them back. So try and squeeze them together. So imagine your shoulder blades, you're trying to squeeze them together, but gently trying to squash them, push them down into your back pockets. That way, if you do what you guys do it now, so breathe in, shoulder blades back together, kind of push your shoulders down, so your shoulder blades are going back into your back pockets. You've got to be doing that all the time. So you won't remember it, but anytime you do remember, so I get people to put a post-it note on their laptop or computer, right posture, keep doing that. Once you've done that, you've optimized your body of how it should naturally be. It may feel unnatural, but that's how it should be. And what that will do, that will place the structures in their correct kind of positions, hopefully, and therefore reducing kind of the amount kind of nerve irritation will happen, repetitive strain will happen. Repetitive strain is going to be when you're constantly using that part of the body in maybe poor ergonomic fashion, and it's fatigued, and that's how that inflammation occurs. So it's changing that behavior. Of course, there's some job roles that it's very difficult, like typing job roles, some of you are probably going to be majority doing, construction. But it's about being conscious of it, and if you can take those micro breaks. So it's not uncommon for a healthcare professional, especially working in occupational health, to be saying, look, every hour, up to an hour, you should be at least taking a micro break. That means resetting that posture, going away from that activity. 1 minute, 2 minutes, it shouldn't have any impact on your productivity. You're going away, deep breathing, just resetting the bones, shaking them out, shaking your arms out, legs, so just resetting it. and then going back to that. And that should lower the risk of RSIs or repetitive strain injuries from occurring. All right?
That's brilliant. Thank you, Peter. Just some feedback for you, because as well as questions, there's lots of really positive feedback. Just saying brilliant answer. Thank you. Great answer. Thank you for giving up your time. So everyone's really appreciative, which is great. And you know, from our point of view, it's great to be able to get an expert in this field on to do a webinar today for all our organisations and particularly their employees. So it's fantastic. So thank you so much for giving up your time today.
Oh, thank you very much. I appreciate it. I'm always happy to help if, yeah, anything in the future that anyone requires, I can try and make myself available.
That's brilliant. Thank you so much. And just a quick one to everyone. Sorry if we didn't get time to answer all the questions. There are lots and lots on there, so I've done my best to get through as many as we could, and specifically all the ones that were, shall we say, most asked. So that's brilliant. Thank you all for your time today, and I hope you enjoy the rest of your week. Take care, everyone. Thank you so much, Peter.
No, thank you. Okay, bye-bye.
All the best. Bye. Bye.